Mark Girvan, I'm Programme Manager working for Next.
Paul?
I'm Paul Nellisthp. I'm a GP in South Tyneside, and I'm one of the clinical editors on South Tyneside Health Pathways.
Right, okay, so we had a really exciting event today, lots of discussion already happening, lots of people in the room, and you're going to be doing a carousel. So if we can start with Mark, can you just talk me through what your carousel is going to be about?
Certainly. So Paul and I are going to be talking about an initiative called Health Pathways. Health Pathways was one of the things we adopted when we started our partnership work with the Country District Health Board in New Zealand. They saw the work of Health Pathways as a critical enabler to their transformation they've seen in their system, moving to a whole system approach. At its simplest, Health Pathways is a process whereby local GPs meet and collaborate with local subject matter experts, usually consultants at the hospital, to come together to develop condition-specific pathways of care that inform GPs during their clinical consultation of how we do things around here. So they're condition-specific, so they tell the GP how we think we should manage, monitor, assess and request support from specialist services with any different condition, and it informs them about the process within South Tyneside.
Great. So Paul, you're a GP. Where do you practice?
I practice in Whitburn,
Right, okay.
and as a locum, so in South Tyneside.
Right, and what's your bit in this process?
Well, I'm here because I'm one of the I guess, foot soldiers of Health Pathways. I represent primary care and really try and build up the relationships between primary care, secondary care, third sector, allied health. I basically go out and organise meetings and don't sit at a computer, but talk to people. I go out and see people and discuss how the system works. I tell them how the system works for general practice and listen to how they tell me how the system works for secondary care. And basically my job is to build up that relationship between primary care, secondary care and everybody else in the system.
So as it should be, Paul, the patient is at the centre of this, so can you just explain maybe a couple of patient benefits from what you're doing?
At the moment, the problem is there's a great variety of care, both between primary and secondary care and within primary care. So even two GPs in the same practice sat with the same adjoining wall can have different pathways of care, different things they do with a patient at that point. The point of Health Pathways is to try and standardise the care so that the patient in the middle of it, wherever they are in South Tyneside, gets the right care at the right time and then gets referred on to secondary care, whoever else, at the right time. So primarily it's all done with the patient at the centre of it, trying to get them the right care.
And Mark, today, as we've said, really exciting event, lots of people in the room. How important do you think events like today are?
Hugely, hugely. I think for two reasons. One, it's an opportunity to listen to our residents, to tell us what is important to them and how we need to shape and inform the services going forward. But two, it gives us an opportunity to share our work and to share with colleagues from other areas, just to promote good practice, to promote opportunities for adoption, and also to hear from them what they're working on for potentially adoption within our local areas. So hugely important events like today.